Good afternoon, Sydney. How's everybody doing? Having fun? I'm super excited to be with you guys today. Coming to Australia is one of my favorite trips. It's very far for me, and jet lag definitely takes its toll. So I've had to survive that for the last few days, but I'm very happy to announce that I slept for 8 hours last night. Thank you very much. I think that deserves a round of applause. Yes, thank you. So I feel fantastic. I'm super excited to share with you my personal journey with this technology and with this company. Also to share as much as possible sort of how I conceptualize and think about utilizing this technology in my day-to-day practice. And just to get to know you guys a little bit more and to have honest, frank conversations about how we can optimize this technology in our day-to-day practice. I'm also super honored to be here with Sach. I've heard a lot about Dr. Sach Mohan over the years. We have a lot of close mutual friends. I've actually learned a lot from him myself. Some of the concepts I'm going to share with you today come from his brilliant mind, and I'll highlight which ones those are in case he sues me for proprietary infringement. Just kidding. And super excited to be with all the other wonderful speakers and the excellent Australian team here from InMode. So Dennis, Sherry, Trish, Kate, Victor, and anybody who I missed, you guys are absolutely awesome. Thank you for taking such warm care of us, organizing everything down to every detail. So we are indeed now at the InMode era. A little bit about myself. My journey with InMode did not start recently. Okay, I've been using this technology for almost 10 years, even prior to the company being called InMode, when it was Invasix. Back then, we didn't have Morpheus. We had something called Fractora. And the first internal bipolar radiofrequency system that came out, I still actually have pictures of that machine, did not have a lot of the advanced technological features, advancements, safety parameters that we have with today's technology. At that time, what we had was a single sensor. So we didn't really know what was happening inside the tissue. We didn't have Morpheus, as I said, and we didn't have the protocols and the advanced approaches that we are able to now employ. I didn't own that particular machine. I worked with a physician in Canada who did have it, and I stumbled upon Steve Mulholland, who is now very much involved in this company, when he gave a talk about it at one of the local conferences in Canada. This is around 11 years ago. And then after working with this local physician for a while, I ended up traveling overseas to do training and fellowships and so on, and then I ended up settling back in my own country in the Middle East and decided that I really wanted to see what had happened with this technology. This is around 6 years ago. So I ended up buying my first Embrace machine. And I already had ideas about the protocols that we used to use, and I had an understanding of this technology, but I didn't expect at that time that it would totally transform my clinical practice. I went from somebody who was very heavily reliant on excisional procedures to becoming somebody who is now really in the middle. I still do surgery. I do mostly lipedema surgery, and this technology has incredible applications in that as well. But when it came to facial rejuvenation and non-surgical body aesthetics, it's unbelievable how just so seamlessly this technology became integrated in my day-to-day practice. And without even realizing it, 60% of my practice became focused on protocols that involved bipolar RF. And it has excellent positive aspects in each and every level of patient care. So as a result of this and getting to know this technology very intimately and making every mistake you can imagine and sort of adapting and modifying protocols and learning from great colleagues like Sach and other speakers like Rovati and Pagano, not only am I now so honored and privileged to be a speaker for the company that I truly believe in, I think it reflects also the values of continued education, camaraderie, support, but I consider it a family now, and I really do that. So this is the new product lineup that's coming out. I don't have, obviously, all of these machines, or else I wouldn't be here speaking to you. I'd be out trying to sell them. But I do have a lot of the InMode technology in my clinic. I have the original Embrace. I have the Evolve as well. And I have access to a lot of the tools that Optimus has. Sach is going to speak a lot more to you guys about Optimus and the unique features that it harbors. But I do want to give you guys a quick overview of what this technology represents, what are some of the new features from a technical point of view, And then we're going to delve deeper into the Ignite system, and I'm going to share with you guys clinical protocols, experiences, how I wrap this technology up in my head, where I situated in the clinical paradigm. The opportunity that you guys have is a very, very unique one because you are dealing with a company that is on the cutting edge of surgical and non-surgical body and facial rejuvenation, in addition to a lot of these adjunctive therapies that Dennis spoke about, including, for example, the Forma I, and now I know that they're also testing some technologies for turbinate reductions using RF and so on. So we know that the non-surgical aesthetic market is growing exponentially faster than the surgical aesthetic market. Excisional procedures, even in my own clinic, there's still a demand for them, but it's definitely not as powerful or as high or as sustained as non-surgical. But patients are demanding better results as well, and you need to have the tools and the confidence because of the tools to be able to tell your patient that, yes, I may not be able to give you a surgical result, but I can give you a very tactile, excellent, noticeable, safe, and natural result. And this is what this company does for us. Another thing that's very, very important, you want a technology that has applicability to a wide spectrum of people, okay? If I was a super specialist in a particular type of surgery that I ended up performing once a month or a treatment that I ended up performing once every few weeks, it's not sustainable. This is also, in a way, a business model. We have to admit we are first and foremost doctors. We are first and foremost scientists. We have to be ethical and maintain our human value and our clinical ethics. But we also do run an operation. And like any business-minded individual, you want something that is safe, that is applicable to a wide variety of patients, and something that will be sustained after you invested. This technology has extremely versatile applications and a multitude of ways that you can integrate it, whether you're a surgeon or a non-surgeon in your aesthetic practice. Ignite is the latest and greatest version of bipolar radiofrequency application, be it in its internal format or in its fractional format. It comes and is informed by years of experience, the best minds of engineering in the field, and it is, in my opinion, the protocols and the experiences are driven by some of the most talented, cutting-edge physicians in the world today. All right? They're the super specialists in what they do. So I consider myself a super specialist in lipedema, for example, a super specialist when it comes to acne scar revision, and a super specialist when it comes to minimally invasive and non-surgical facial rejuvenation. But I can also share with you that every single one of my other colleagues is a super specialist in what they do. Alfredo Hoyos is world-renowned for his revolutionary, high-definition, advanced body contouring. And he has some of the most advanced protocols in how to apply this technology. Pagano is an excellent expert in arm contouring and also lipoabdominoplasty. Also adds this kind of incredible scientific guidance and effort. So the quality of the speakers, the people who are using this technology lend incredible credibility on a scientific level to what it's able to accomplish. This is the Ignite. It's an external power unit with the latest and greatest in terms of user-friendly interfaces. And these are the new handpieces that we are now capable of using. The RFAL series, this is the previous technology, the Embrace technology, had face tight, body tight, and AccuTight. Today, the face tight has actually been developed and enhanced significantly, both in terms of power. It is now 40 watts instead of 20, and we'll talk more about that in my other lecture. And the body tight is now 60 watts instead of 40 watts. In addition to this, we have two new excellent tools that have simply changed the game in minimally invasive internal bipolar radiofrequency. And these are the quantum handpieces. We have a quantum 10 and a quantum 25. What you will notice immediately is that the quantum consists of a single probe. You no longer have to worry about manipulating and managing the external probe on the skin. It makes it extremely more easy to be deployed, a lot more efficient in terms of the treatment, and has excellent safety profiles with very, very good results. So we will talk about these in much more detail in my second lecture. The Optimus Max is the second excellent technology being launched today in Australia. And I'll let Sach talk a lot more about it, but as an overview, this is really your workhorse in the clinic. It has everything from laser hair removal for different skin types. It has the world-renowned Lumecca, which has also been now updated and advanced in its 2 formats. Lumecca is the most powerful narrowband IPL in the clinical market today. Sach is going to show you some magic by combining these technologies together. There's the new Morpheus, which I'll delve into a little bit more, and obviously the traditional vasculases and other RF protocols, tools that you can use as well. So the Optimus Max is really your workhorse. You can add or subtract from it what you feel is going to be the most relevant to your clinical practice and scope. The new Morpheus, though, is really at the heart of the IgniteRF and the Optimus Max system. We love Morpheus for a variety of reasons, which I'll get into details of a little bit later, but this new Morpheus is absolutely revolutionary. For one, we've split the handpieces now. There's a specific handpiece called the Ultra Deep, or the Burst Ultra Deep, which is for the body, and there's the Burst, which is for the face. And these two are absolutely phenomenal in what they're capable of doing. There's a short video that I want to show you about some of the new features that these handpieces are going to espouse. So they're right there on the screen. We have the burst mode and the scale mode. The burst mode you might know of from the days when you were doing body treatments because it was limited only to the body handpiece. Today, this burst mode is also available for the face. The face tips can now go deeper. They were limited to 4 millimeters before. Now they can go to 5. And the body tip still goes to 7. But in addition to the burst mode, and for those of you who don't know what burst mode is, it's when we're able to deliver pulses of radio frequency at multiple depths in a single shot. We also have something called scale. And this, in my opinion, is excellent because now we're able to deliver larger energy at the deeper position, but as the needles are retracting up, we're able to deliver lower energy more superficially. So we can preserve and deliver a safer pulse in that very fragile and precious superficial layer of the skin. So both burst and scale are now available in both Morpheus handpieces, the face one and the body one. And this is a quick recap of how they look. So you've got the Morpheus 8 burst and the Morpheus 8 burst deep. The burst is for the face, the deep is for the body. Again, we have the scale and we have the burst. These are pre-programmed, and we are able to set the depth that we want to deliver the energy to, and when we choose the scale mode, the more superficial pulses decrease in terms of the energy profile that they deliver. And it looks something like this. So you can look on the scale how the energy is actually being reduced in terms of intensity as we get more superficial. Morpheus 8 Burst has the only current FDA approval for soft tissue coagulation, tissue contraction, and depth of up to 7 millimeters. This is a brand new accomplishment that I think really sets it apart from the rest of the competition. Again, it's dual handpieces. We have the same pins that we used to have before, so we still have the prime, which is really delivered around the eye and around the mouth with the 12 pins. You have the 24 pin for the face, the 40 pin for the body, and the resurfacing tip, which I think is one of the most underutilized tips in the Morpheus arsenal, is also available. And we'll talk about how you can really tailor these to different clinical scenarios in your practice. The burst we spoke about. The nice thing about bursts now, it's not just the pre-programmed depths that we used to have in the old system. It's not just 7.53 millimeters or 6.42. You can arrange the depths that you feel would best serve this patient. So if you want to do 7 and 5 because you want to tackle some deep fat, but you don't want to do the 3 millimeters because you're worried about affecting the subcutaneous tissue, you can do 7.52 or 7.51. You can determine any variation of depths that you feel would give this patient the best result. So the scalability of this is really unparalleled. And in addition to this, you're able to use that scale mode when you're concerned about that superficial pulse being too strong. You want a really high energy deep, but you want a lower energy superficially. That scale will keep you safe. Safe, and will give you excellent outcomes. And again, these are the classical tips that we love and that we've known for many years. They've just come back now in this new, more powerful format. Why Morpheus is different than the other technologies, we're going to get into in more detail in the second part of my lecture, but you have to understand this is a very unique pulse that's being delivered. It's not your classical little burst of energy that barely does anything but create edema in the face. This is a volumetric, three-dimensional contraction, explosion of energy that has a multitude of effects on the tissue. Okay, you can look in this middle and see in the middle of that pulse, that red part there, that's your ablative signature. That's how powerful Morpheus is. Morpheus can evaporate tissue. Surrounding that is your coagulative crust, and then obviously some non-specific heating. Using the protocols I'm going to share with you today, you can tailor your approach to target specifically the layer of tissue that you want and have the effect that you want in it. Remember that this is energy being delivered into the face. This is a sensitive area with really precious tissues and layers. You want to have as much control as possible when you're delivering this particular amount of energy into the tissues. The controllability, the different targeting of layers, the volumetric bulk heating, the large contraction zone, the full thickness subnecrotic heating, all of that sets this apart. And to give you an example about how much control you have in the energy, we have mapped it down to exactly how many micrometers of coagulation you will achieve depending on the energy that you choose. So if you do an energy level of 60, you're going to get a coagulation zone of 1.4 millimeters. And you can tailor that energy profile depending upon what you want to accomplish. So this is a technology that's being espoused and utilized by everybody in the world today. I don't know anybody who is really working in aesthetics and has this technology that isn't absolutely in love with it and will claim in the loudest voice possible how much of a difference it's made for them in terms of patient outcomes and in terms of patient satisfaction. Whether you're a surgeon, you can use these technologies to really improve your outcomes, improve your skin quality, treat the scars that you need to, and if you're an aesthetic doctor, the aesthetic applications are phenomenal. The lectures and the studies that are coming out are really top of the notch, solving all kinds of problems. This is a study about how malar edema from previous filler injection can be targeted with this technology. There's very, very advanced protocols here with excellent results. Again, age-related changes in the skin. You need to be convinced. You need to see the dermal thickening. You need to see the increase in collagen staining. It's all there. And I'm very proud as well that my study assessing Morpheus's amazing impact on acne has just been accepted in Aesthetic Surgery Journal and should be coming out very, very soon. This is a photo that we like to use often in the company because it really reflects the kind of power you can accomplish with the new burst in the face. You can see a thicker dermis. You can see repositioning of some of the tissue. Probably Sach will argue with me on that. It's probably not repositioning as much as it's tightening, thickening of the dermis, and so on. But she looks fresher, really a lot tighter, and you have now set the stage for anything else you want to accomplish with this patient, including volume restoration and so on. So these are the hand pieces again in a nutshell. We have our face tight turbo and our body tight turbo. We have our two quantums and our Morpheus. And with that, I'm going to enter into my next lecture and start talking about the scientific aspects and the clinical applications. I like to use this picture. I use it in almost all of my talks. And the reason is because I feel that it's a great pictographic representation of the changes that are happening beneath the surface. It doesn't get everything right. I don't think they do a good job of reflecting what's happening with the muscles. I don't think we know a lot about muscle aging. We're still learning. But it does reflect everything else that seems to happen, and it reflects it in a way that I think is very scientific and mechanical. So When you look at an aging face compared to a youthful face, and you look at the level of the bone, you'll notice that we get a lot of bone resorption as we age. So you can look at the zygomatic bone here and see how it's been reduced in volume. You can see how the maxilla has also lost volume, and now you can see the roots of the teeth. The mandible is thinner, the orbital aperture is now wider, the nasal aperture is wider, the temporal crest has become thinner and wider as well. So the bone, as it's resorbing over the years, contributes to a loss of support for the soft tissue. We end up losing a lot of that anchoring support that we need for the soft tissue to lie on. If we look at the soft tissues themselves, though, you also see significant changes happening as we age. You see that the skin begins to lose collagen and elastin, becomes thinner, but it also begins to slide down its axis. It's folding up on itself. So it's not just a question of losing thickness or losing volume. We're actually getting a repositioning of that tissue downwards because of gravity. If you look at the fat, it also undergoes some changes underneath the skin. You're going to lose some of that volume, of course, in some areas. In some areas, you actually get hypertrophy of the fat. But in most areas, the main sort of anchoring points, the fat actually reduces. But something else is happening, which is really important. I love this picture because it shows it. The fat is changing its position. It's not just a question of shrinking in size. It's also being repositioned. It is becoming ptotic. It is medializing. Why is that happening? Why are things sliding down if it's only skin that's aging and only fat that's aging and only bone that's aging? Because it's not just them that are aging. We have a very powerful, I think, underestimated structure in the face. Actually, it's in the whole body, but in the face it's very, very important. And it's called the anchoring complex. This anchoring complex is like a weave of different kinds of collagenous tissue and structure that tends to kind of keep all of the layers attached, right? It allows the skin to attach firmly to the fat, which in turn attaches firmly to the muscle, which in turn attaches firmly to the bone. So the conceptual framework I use is the door hanger, okay? The coat hanger on the door. Because what we have here is we have our soft tissue, which we can see, and that consists of skin, fat, muscle. And you have the door itself or the wall itself, which is the bone. But there's a nail that keeps the coat hanger hanging. And that's your anchoring complex. And it looks like this. It goes all the way from the skin down to your bone. And it has different names depending on the area we're talking about. So between the skin, as it weaves through the fat down to the muscle, we call it the fibroseptal network. In the muscle itself, it has the name thickening. And then when it reaches the bone, it's a ligament. Ligaments actually don't age. In my past life, I used to do a lot of deep plane facelifting. I don't do that as much anymore because I don't have the demand for it in my market, and lipedema is more fun. But when I would go in to do a deep plane facelift in a 65-year-old woman, I would have to release something called the zygomatic cutaneous ligament, because that's the whole principle of deep plane facelifting, right? You take down the ligaments and sort of redrape all of the soft tissue. It was difficult to take down that ligament. It wasn't easy. It wasn't something that had aged. Ligament was quite firm. I think we think about ligaments as aging because of the fact that the volume around it, around the ligament, has kind of shifted. And so we think that it's become more supple, but it's not. The example I give is my belt, right? I know it's hard for you guys to imagine because I'm so fit, but the reality is, when I do lose weight, it looks like my belt has become looser. But it's not that my belt has weakened. It's just the fat abutting against my belt has become less. That's why we think ligaments weaken, but they don't. Ligaments actually don't age that much, and they actually remain strong. Where we do get aging in the fibroseptal network, this is really important, we get it up here, in that fibroseptal network area of the anchoring complex. Specifically, actually, the more superficial FSN. The deeper FSN, which is the FSN between sort of the end of the fat and the muscle, that ages, don't get me wrong. But it ages a lot more up here. And this is an area that we need something to be able to target it with. Historically, the only thing we had is surgery, right? We had to cut out the skin because it had become too loose. So it was like redraping the tablecloth over the table. We didn't really have a lot of tools to target specifically that anchoring complex. But now we do, because radio frequency technology, especially in the way that Morpheus works, has a beautiful predilection for that layer. But it's a game of balance, right? Because you're putting energy into that FSN, but that FSN is also surrounded by fat. So how do you create that balance of targeting the FSN without damaging that fat, especially the precious fat, which is in the subcutaneous layer, which is actually part of your skin, if you think about it. Subcutaneous fat is a skin structure. Deep fat is a different story. So why is it that Morpheus is able to do that, whereas other radiofrequency microneedling technologies can't? Why is it that other radiofrequency microneedling technologies give you edema and give you results that seem to be there for a few weeks, maybe a couple of months, and then everything is back to where it was? It all has to do with the physics of how this stuff is structured. If you look at the current systems on the market, the bipolar systems on the market, it's a row of positively charged needles next to a row of negatively charged needles, and it goes back and forth in tandem. If you look at it from the side, it's a positively charged needle next to a negatively charged needle. This is insulated, of course, so the energy is only going to travel from this little needle to that little needle, create a little spark of energy. I call these needlers. I really do. Because all they're doing is microneedling with a little bit of energy. You're not really changing the architecture of the tissue. But look at Morpheus. The whole setup is different. The positive needle is not going to travel to the needle next to it. It's going to travel to the negative electrode all the way at the base of the cartridge. So you're getting a very, very unique pulse being delivered into the tissue. No other technology on Earth is able to do this currently. HIFU does not do this. It gives you a series of coagulation points that are horizontal and don't really do anything. This is really getting that whole three-dimensional structure of the FSN to react in a beautiful way, and you can often see the contraction in front of your own eyes. And remember that red that I showed you earlier? Remember that that is ablation. This is a high ablative index technology. You're talking about ablation, which usually gets our brain to think about CO2 and erbium. That's exactly what this is doing, but it's able to do it much, much deeper than those other technologies. So there's a lot of power in this. There's a lot of responsibility as well. And around that red is your orange, which is the coagulation profile. And that has a completely different effect on the tissue. You can play between these two. You can make Morpheus more ablative or more coagulative by setting up the correct parameters, determining how you're going to deliver the energy, and also understanding what kind of patient you're treating. So I call this the AFDI, okay? And yes, you're right, it does spell my name in a different way. And I did it on purpose to try to make a lot of money off of the CEO. But when I proposed this idea to him, he said, this is the stupidest thing I've ever heard. If you called it Morpheus, I would pay for it, but I'm not paying for it now. But nevertheless, I went through with it because I think it's a smart way to think about what it is we're trying to accomplish. And honestly, I have to give credit where it's due. This is actually an idea that came to me after I understood how Satch was approaching treatment with Morpheus. He's a world expert on this technology. And he was the one who was talking about how he tailors Morpheus in different settings depending on whether he wants to reduce fat or target skin. And it was like a big wake-up moment for me. It was maybe 4 years ago. I learned it through another doctor called Michel Ibrahim, who had heard him speak about it. And I started to say, okay, well, if that's the case and I can tailor this technology to different layers and have different effects, how can I create a conceptual framework that would simplify the process of choosing what I need to do? And I think AFDI works super well. Because the A represents the first question. Do I want to ablate or coagulate the tissue that I'm working on right now? And depending on what I want to do, I go to the F and I determine which mode I want to use, which is fixed versus cycle. Now, for those of you who know fixed and cycle, it's super, super easy. But for those of you who don't, I will explain it. And then I'll show you a video of how it works. So fixed means that when I press on the foot pedal, and the needles emerge into the tissue, they stay in the same position where I put them. The needles do not retract. So they stay in the same position, and I'm able to deliver more than one pulse in that same position. We call that stacking. So I'm able to deliver 3 pulses or 4 pulses. Now, because fixed mode is a longer pulse duration, the ablative signature of that pulse is larger. And because I'm able to accumulate these pulses one on top of the other, with each treatment, I'm increasing the amount of ablation that I'm achieving. And it's not possible to just ablate fat. It's possible also to ablate skin. If that skin is glycated and thick and photodamaged and you don't want it, you can also eliminate it, and I'll show you how. The cycle mode, on the other hand, is designed to deliver much shorter pulses of radio frequency. The needles will automatically retract even though you're pressing on the foot pedal. So it's a shorter pulse that's really not designed to ablate. It's designed to create micro-injury and collagen remodeling through a process of coagulative necrosis, and really to lead to tightening and contraction more so than ablation. So this is how a fixed would work. Watch. I'm about to deliver fixed into this patient's submental area because I want to ablate some of that deep fibrotic fat that's there and reduce its volume. Okay, that's fixed. That's how you target layers of fat or bad skin that you want to get rid of. This is cycle mode. It's a completely different process. I'm doing repetition single. Okay, so I'm delivering these short pulses of RF very, very quickly. And as a result of that, I'm creating a heat signature in the skin to allow it to tighten, as well as introducing small micro-injuries in order for that skin to remodel over time. Depth is very, very important. You're going to hear a lot more on depth from me and Sach throughout the days and years, but it's really crucial. And we'll have our back and forths about it. We each have our own approach. But where you treat, where you put that energy makes all the difference. If you're targeting fat, then you want to be deeper. But sometimes, if you're not deep enough, you may end up targeting that subcutaneous fat. And you don't want to target that subcutaneous fat because it makes the skin really skeletonized and depleted of its resources. Because remember, that subcutaneous fat is part of skin, right? So it's really tricky. And you need to really kind of feel the tissue and understand what you're treating. And there's other ways that you can do it as well if you want to be a lot more precise, which is by using a little bit of ultrasound. And I think this is something very important for us as aesthetic doctors today. We need to get the ultrasound into our practice. Nevertheless, though, when you feel the tissue and understand what you're treating, you can determine what the depth is. And remember that skin has different thickness in different areas, and fat will have different thickness in different areas, and no patient is the same as the other. So it's easy and it's fun, but there's a lot of clinical thought that has to go into an effective Morpheus treatment, and that's why I love it. Because I don't want to be just a, no offense, dumb technician that just applies things. I want to think about things, and I want to really consider what it is that I'm trying to do. And remember that skin, when it's thick and glycated and dead, it's actually a lot thicker than you think, and you need to go deep to really ablate it. This brings us to the eye, and that's intensity. And this is really where you determine the energy you want to use. You want to determine how many stacks you want to give. You want to determine how many passes you want to accomplish, and so on. It's really, really important to think about these things and understand what it is that you're doing, and to understand that power equals energy multiplied by time. This is a concept that also was an aha moment for me. And what it's trying to say here is if I deliver an energy of 10 over 1 second, I'm going to have a power of 10. And if I deliver an energy of 1 over 10 seconds, I'm also going to have a power of 10. But the value is not what's important. It's how that energy was delivered, because each of these will have a completely different effect on the tissue. And I owe this actually to Riccardo Forte, who in my opinion is a guru of energy-based devices today. He's a surgeon from Italy. I had the chance to train him on FaceTite, but he's also a very prominent laser user. And a lot of energy-based devices have sort of come under his wing over the years. What I like to do is I like to think of using lower internal temperature when I want to target skin tightening or skin retraction. Because when I use lower temperature internally, I'm able to then affect the fat that's under the skin, where that FSN is that I need to contract, in a way that doesn't destroy the fat. I coagulate it as opposed to ablating it. And this concept has been really, really important. So even when you're using the Morpheus, just understand that when you're delivering high energy for a short period of time, you're probably going to ablate tissue. But lowering the energy a little bit and delivering it over a longer period of time also works and has a different kind of effect. Am I over time? Yes. No, my lecture is until 1:30. No, I'm serious. Isn't it until 1:30?
No, you still have, I'm joking.
Oh, Jesus, you scared me. Now you almost made me sing. I need to sing just to calm down.
And dance.
Yes, I'll do that later at the gala dinner with alcohol. Okay. Yeah. You'll give that to me after. I'll calm down again and everything will be all right. So pain control. Sach's going to talk a lot more about this. I decided not to go into it so we don't overlap. But you can use any strategy that you want. My personal strategy is as follows. I tend to calm the patient down for about 15 to 20 minutes prior to the treatment by putting them in a room with some music and giving them a nice drink. Then, if they want, I offer them an anxiolytic. I do use topical. And by the way, using topical for 40 minutes versus 1 hour makes a world of difference. At 40 minutes, it won't work. At 1 hour, it will work. And just standard EMLA is more than enough. 2.5 prilocaine, 2.5 lidocaine. Some people get compounded products. Use whatever product you want to use. I put them under the EMLA. I cover their face with plastic wrap for 1 hour. If they want to start at home before they come to the clinic, we give them that option as well. They come in with 20 minutes left to their session. We replenish that anesthesia and put the topical on. Cool air has been absolutely phenomenal. Okay, Zimmer has a version. There's a lot of others. It's a good investment for somebody who has a lot of energy-based devices. Doing that cool air on the area helps a lot. And when I know that somebody's super nervous and it's their first time in the clinic and I'm not sure how they're going to react to high energy that I'm planning to use, well, I'm going to deliver a nerve block. I have my own way, Sach has his own way. They're pretty similar, so you'll watch that a little bit later. And I'm happy to share these videos to Sherry, who can then send them to all of you to just look at the protocol and how we do it. So let's do an example of Morpheus. This is a patient who's 62. She's healthy. She doesn't take any medications. She has significantly photo-damaged skin, and she's super, super, super thin. She has almost no fat. I looked at her with an ultrasound. There's no fat under that skin. Very little islands of fat subcutaneously, but it's all thick, dead skin. I offered her a CO2 or a phenol, and she completely refused. This is a woman who goes out hiking every single morning. She's recently retired as a gym teacher from one of the big schools in my country. She just wants a little bit of a rejuvenation with minimal downtime. This was really important to her, minimal downtime. So let's do the AFDI. I want to ablate that mesolabial skin. It's really, really thick, right? I want to ablate the neck skin. It's really thick as well. And the nasolabial skin down here. I want to coagulate, though, the skin in the other areas without targeting that precious little bit of fat that she has. So I'm going to use fixed in some areas and cycled in others. I chose 3 millimeters in her at a very high energy of 50. 50, by the way, is not joules, okay? It's an arbitrary number that reflects how many millijoules there are on each pin. And it's just as you go up, so let's say from 50 to 60, you go up from 112 millijoules per pin to 156 millijoules per pin. That's a very, very high energy. And 3 millimeters is a controversial depth, as you're going to hear from Sach, because in a standard patient, that's where your subcutaneous tissue is, sometimes. Sometimes it's not, it's more superficial, depending on the thickness. But in her case, there's no subcutaneous tissue. There's very little of it. This is just scarred skin. So I want to eliminate it. So I did that with a stack of 4, and then I cycled at 20 for 4 passes, and then I did 1 millimeter as well because I really wanted to get into that dermal junction. And then I used the resurfacing tip, which is super, super important. And this is her 8 weeks after 1 treatment with nothing else done. I did absolutely nothing else for this patient. And she was happy, and she said, that's it. I'll see you in a couple of years. And I haven't seen her since. But I spot her walking. Very, very, very good result. This is where Morpheus is the most powerful. When you are tackling skin, okay? It is amazing at ablating skin. It is amazing at thickening skin. It is amazing at tightening skin. It's a little bit less so when it comes to fat, depending on the type of fat that you are targeting. So we have fat in the face that's super precious, like our cheek fat. That cheek fat is very responsive to Morpheus because it's not a fibrotic fat, it's like butter. So you want to be very careful when you're using Morpheus in this area because you will melt it. As you get lower in the face, fat becomes more fibrosis, more fibrotic. And that's the same for the body, by the way. So very, very non-fibrotic fat here, which can easily melt. A little bit more fibrotic fat here, and if you're too aggressive, you'll also melt that and actually make the skin more crepey. Skin depends. If it's a congenital double chin, somebody that's just born with it, it's very fibrotic. Morpheus will actually not give you a very good result. But sometimes it's weight related, and it's very, very good result that you will be able to get. So Morpheus, you have to think about it as number one, it is a skin treatment. Bad skin, photo damaged skin, thick skin, crepey skin. Secondarily, it can help you with some fat, but we also have other tools for that now. So the old Morpheus had fixed and cycle when we talked about the face, but the new Morpheus has a brand new type of mode. Can somebody shout it out? Talked about it earlier, see if you're listening. Was I too boring? Burst! We now have burst in the face. Burst is an optimized version of the fixed and cycle and actually gives us the best of both worlds. Burst is an ablative mode that also has incredible coagulation. So when you use it in the double chin, it should be 10 to 15%, maybe 20% better than the old Morpheus, targeting even the fibrotic fat. So now you are capable of delivering this, whether it's in scale or not in scale, into the particular area that you're targeting. So in this video, you will see me delivering the new Morpheus, burst of 5 to 3, no scale was used, which means that at 5 and at 3, the energy was 30, which is the highest, and I did 2 passes of this. And this is how it looks, okay? It sounds a little bit different than the old Morpheus. It doesn't give you 2 pulses, but it'll give you a single pulse, but it'll hit at 2 depths. I'm delivering at 5, and I'm delivering at 3 in that double chin, okay? I did 1 session only for this patient, and this is her after 6 weeks. It's not perfect, but you can see a significant reduction in that subcutaneous, subdermal thickness, and the jawline is a lot better. You can see it here as well, and this is from 1 session only. But as you can see, she already had some loose skin centrally. It's better, it's reduced. It's not perfect, of course, but I wanted it to improve. So I'm now able to offer her, and I did, the quantum. That's that second layer of treatment that is single probe. It has the bipolar mechanism just at the tip. I no longer have to worry about external electrode and cantilevering up and down and all that stuff. It's super, super easy. It's done under local anesthesia in my clinic. I don't wear masks or anything. It's just injectable RF. And it looks like this. 40 watts, 7.5 joules, 1.5 pulses per second. No aspiration. You can optionally do a fat drainage. We don't call it liposuction. You can do it in Australia, of course. You can do a fat drainage by using a small cannula and syringe, or you just massage out the little tiny amounts of oil that are produced, not much oil. This is a great product because I'm immediately in that subcutaneous layer, which I told you is part of the skin and really important to tighten the skin, but I'm not melting it. This is non-ablative. You get very little melting when you're in that layer because you're actually just contracting that FSN. So by contracting the FSN, the fat occupies less space, so it looks like you've reduced the fat, but you're actually keeping the fat very functional with its blood supply and everything going to the skin. And it's super, super easy to do it. You can hear the crackles. That crackle, by the way, she's not in any pain. She's just like that. She's one of my favorite patients, but she's always moaning and groaning, even if I just say hello to her. So don't worry. She's not in pain. She just doesn't like being in that position and so on. In fact, you can see, yesterday I had the honor of meeting Dr. Lisa, who's suddenly become one of my favorite people. She's an Australian plastic surgeon, super, super, super talented, very welcoming and warm, and I was very impressed with her skill set. This is her doing the same treatment yesterday in a small double chin that didn't want any aspirational procedure. Hear the crackles, hear that contraction happening. You hear the crackles, they're amazing. Okay, super, super efficient, and I'll show you some results in a minute. Then Dr. Wen Shan did a great job as well doing the Quantum 25, which is for the body, not for the face, in a patient with loose arm skin and some soft tissue excess that didn't want a brachiplasty or a liposuction. And Dr. Wen Shan is an aesthetic doctor. He didn't need to aspirate or do anything. We just put a little bit of anesthesia in using a multi-injector needle, those mesotherapy needles, so he didn't even have to put a cannula in. You can do it with a cannula as well. And he just goes in and treats the whole arm. Super easy. And you can hear that crackling. That crackling is not fat melting. Fat melting has no sound. Crackling is FSN contraction. It's very powerful, guys. Look at my patient, okay? This is her before video and her after video. This is a quantum at 6 weeks. Just a quantum. I did a little bit of aspiration with a syringe. I barely got out 3 or 4 mils of oil more than fat. Okay? Excellent, excellent redraping and remodeling. So this is a game changer. It's also a game changer for me as a surgeon because I can now deploy it immediately after liposuction, even in my large volume lipedema cases, to get very nice redraping of the skin. This is not a body talk today, or I would have shown you. But remember, this is our classical technology. This has all been updated, has all been improved. This is what's happening. Those cracks that you guys were hearing, this is what's happening when we hear those cracks. We're not melting the fat. We're allowing that fat to contract, and it does so immediately. It is an immediate tightening and contraction of that soft tissue. And when the fat contracts, it automatically takes the skin along with it. So we get length contraction happening immediately. This is a flap that we took from an abdominoplasty to test this. The Quantum is an amazing tool, but we may sometimes need to deploy a little bit more power. This is more a surgical or interventional procedure. That's where the face tight and the body tight comes in. And they've been significantly upgraded in terms of power. Why is that important? It means that when I'm working with the face tight, that's at 40 watts, and I set my internal temperature to 55, which is relatively low, I'm still going to be able to reach my external temperature efficiently because there's a lot more power driving that RF. I don't have to be there for 20 minutes waiting for the external temperature to come up. This is a face tight turbo that I did recently in my clinic. Super efficient. The internal probe is actually now a lot more rigid, so it doesn't flop when you're in the tissue. So for users, it's much easier, much more adaptable, because you're not worried about it becoming too superficial or going to the right. It's quite firm, and I'm using, obviously, the different points and techniques that I utilize to really define that area. And when I am doing face tight or Quantum or Morpheus, I heat the skin differently than the fat. And this brings us back to this idea of using lower internal temperature and heating the skin and fat less aggressively. It's called a slow cook. A slow cook means that the internal temperature on the face tight is a lot lower, and it takes more time to reach the external temperature. But it gives you an ability to more thoroughly heat the tissue and get all of the FSN layers contracted. Quantum is basically that concept for people who don't do face tight. You can bring it up right above right abutting the dermis, and by moving it, you're delivering this small bout of safe energy, targeting specifically the FSN here, where the contraction happens.
So I'm delivering the
And
energy
on top
at
of
two
that,
different depths.
you do the Morpheus after the quantum.
And
You get a very
I've
nice synergistic
predetermined
effect, and now you're targeting the dermal collagen component, not just the
my
FSN on the inside.
temperature
So
is
you're
at each
heating
depth.
and contracting from the inside, you're heating and contracting from the outside. It's really a very
Needles are
efficient
penetrating in a
and
good
very
way,
brilliant
And
concept.
you can see that there's actually excellent control in the needle penetration, so you don't have any motion.
The needles have been designed in the new Morpheus to be even more efficient and more precise. So when they enter the skin, the reverberation of those needles has been brought down by 20 to 30%. So you are getting very, very precise micro-injury into the tissue. Let me give you some results so you guys are convinced. This is a FaceTite Pro that I did. It used to take me about an hour to do this procedure. It now takes me 25 to 30 minutes because this FaceTite Turbo is a lot more powerful and it's able to get me to my external temperature a lot faster, but still slower than had I used a high internal temperature. I use a low internal temperature, so I'm doing a slow cook of this tissue. This is another FaceTite. Okay? You could probably do quantum here as well. You'll get a little bit less of a result, but this is a patient that's classically and historically for facelifting. But she doesn't want a facelift. I have 2 minutes and 47 seconds. You sit your butt down, Sach Mohan. I can see you eyeing my spot. All right? This was a great result with very minimal downtime. Here's another one with a huge double chin. This is difficult to do quantum on because you have to reduce some of that fat there. So if you get a case like this and you're a non-aspirating physician, refer. But if you get a case like this, you can do it just with the quantum, and that's what I did here. This is a patient with loose skin and a little bit of fat accumulating under it. It took me 20 minutes to do this case. I was shocked by the result. This is really early on trying the quantum when I didn't know what to expect. It was a fantastic redraping of her skin. You can even see a little bit the axis point. It was still kind of healing at 3 months. But really, really powerful. And you can apply it to a variety of neck and skin types, younger patients, older patients. This is a case I did in Los Angeles with Nader Kazi. Nader is a really, really well-known Newport Beach cosmetic surgeon, and this was his assistant. It works, and it's really beautiful. Morpheus as well in the body. This is Dr. Michelle Ibrahim's case. But you can see how powerful the new Morpheus is at redraping the skin. Okay, the fat hasn't been reduced a lot. Okay, and that's fine. It's reduced enough. But it's really a skin tightening, skin remodeling technology. From the side, this is a perfect case for Morpheus. This is the kind of fat that Morpheus is really good at getting rid of. It's that fat that's loose and kind of hanging down with the skin. My fat, which is definitely not loose and definitely not hanging down, there's a lot of it, probably wouldn't respond as well to the Morpheus. It probably requires liposuction or body effects or evolve. But the Morpheus is really a skin treatment, and this kind of subcutaneous fat that's really just become damaged and exists in islands in that crepey skin, one session, guys, from V-Derm in Bulgaria, from my friend Evgeny Sharkov. This is my result. This is at like 3 or 4 weeks. There's still some marks there, but look at that excess skin. It's gone. The umbilicus is looking less hooded. So some people will talk about these marks. We can go into it a little bit in detail. There's a lot of different theories about why they happen, but I just wanted to give you an overview, and I can tell you some strategies to tackle them. You're going to hear about a lot of attacks on Morpheus online. This is me responding to one of them. They're really just based on jealousy and anger and really not understanding the technology. If you get a bad facelift result because your surgeon isn't good, doesn't mean that facelifts should be banned. This is a safe technology with tons of studies to support it. Acne is another area that's near and dear to my heart. I'm just going to take one more minute. This is the study that I just published. Generally speaking, it's a disease that is very chronic, especially adult onset or adult acne. It's very difficult to cure it, and using isotretinoin regularly in high doses is not very effective. And in fact, in about 30% of people, isotretinoin doesn't work to begin with. And in the 60% that it does work in, there's a huge recurrence. Within 5 years, about 50% will recur. Isotretinoin also will reduce the inflammation and get rid of the sebum and improve skin turnover, but it doesn't really do much for your scars. So using the Morpheus is a lot more effective at getting the scars remodeled. So I put the settings up there for you. I only choose 3 millimeters if the scars are early and thick, but these are some of the results from my clinic. Consistent results. This is always what I get. It's a big part of my practice, and quite frankly, it's my workhorse right now. Botox and this. I get 6 to 7 acne sessions every day, and these patients are really struggling, and they are very committed and come back and bring their friends and their cousins as well. Very, very good and very effective, and this is probably the best case. This is a skin type 5. In my country, we have an African Palestinian population. I'm from Palestine. So these are actually Nigerian immigrants that came to the country hundreds of years ago. So we have a lot of FITS 5, FITS 6 patients. She struggled. She did isotretinoin 4 times and failed. So she came to me. I said, listen, let's try. This is 6 sessions of Morpheus. Complete improvement, excellent skin. She comes in now once a year to maintain. Last thing, because technically I have until 1:30. I can hear you whispering. Remember, guys, we are doctors, and we treat patients who present to us with different expectations, but with different biology. So I'm trying to help you with this picture in making your decisions correctly. If you get a patient that's very, very thin like this, with very little fat underneath, and just really thick, glycated skin, this is perfect for Morpheus. It will give you 50% of a CO2 or phenol from 1 session. And if you do a second and a third, you'll get even better and better. It is ablative, it is powerful, and it really works well on skin. If you get a patient that also has loose skin like her, but that skin is a little bit tautic and it has a little bit of fat accumulation under it, you can still try the Morpheus, but you probably won't get the best results as you would with Now Quantum, which is designed for this kind of picture. If you get a patient like that, significant amount of loose skin or a significant amount of fat, the Quantum will help, but it probably won't give you the same result as the Face Tight. And if you get a patient like that, with significant deep structural deintegration of her tissue, she needs surgery. Or you can discuss with her other options, but don't overpromise. Baker 1s and 2s are ideal for an aesthetic clinic. Baker's 3s and 4s, you have to start thinking about sending them. These are the kinds of patients you can help, even if it's not a perfect result. These are the kinds of patients you should not try to touch their neck. These people need a surgeon. Thank you very much for listening. Here are my contacts, Instagram and email. I'm more than happy, night or day, because that's my life. I just sit on Instagram answering questions. Anytime you want to discuss a case, hey, Dr. Fadi, I just got the machine. I'm kind of not really sure how I'm supposed to treat this. Send me pictures. Show me that you've tried to think about it, what your concern is, what it isn't, and I always answer, really. I get emails and contacts from all around the world to the point where my wife wants to divorce me. But what I've done is I've set up a few hours a week where I get back to these queries, and I will help you. I will guide you through how to optimize the use of this technology. Thank you guys for your warm hospitality. Go Australia!